High school and college baseball seasons are ending. Summer season's about to begin. What should pitchers be doing in between, if anything? Coaches, you'll want to keep an eye on your pitchers' necks. Why? Because improper neck tilt can rob velocity and cause arm injury. We'll go into the details on how to troubleshoot and fix that. Speaking of pitching injuries, they seem to be trending beyond elbows and shoulders, moving toward blood clots and thoracic issues. Why? We'll attack these issues and more in Season 4, Episode 5 of The Fix. So here we are, Season 4, Episode 5 of The Fix with pitching motion troubleshooter Angel Borelli. I just wanted to get a few things out there. For those of you who have not yet subscribed to Baseball Pitching The Fix on your iPhone or Android device, please go subscribe to the podcast. If you have no idea what a podcast is or don't know how to download a podcast, you can now get us via an app. We have an app on the iPhone, and we have an app for the Android. So all you have to do is go to your app settings and look for Baseball Pitching The Fix. You will see the little baseball and just download the app. So Angel, that's pretty cool, right? We got an app.
It's very cool. I'm excited. Make it easier to access. That's great.
Yeah, we're trying to get the message out as easily as possible and get it to everyone in every possible way, because a lot of people have no idea what a podcast is or how to get one, and I understand that. So we're just trying to make it easier. So if it's easier for you, please go to your app on your phone and just look for Baseball Pitching The Fix, download it, install it, and you're good.
Nice.
Yeah. So with that out of the way, let me get on to the trending topics in Major League Baseball. We have, as usual, more and more injuries for baseball pitchers. I'm just going to go really quickly through some of the more recent and prominent ones that I've seen. We talked about Shelby Miller in the last few episodes. He actually has undergone Tommy John surgery, so he's now on the way back. Hopefully he'll be back in about a year and a half or so. Aroldis Chapman has a rotator cuff inflammation. He'll be out for about 2 weeks. By the time you hear this, he might be back. Oh, and by the way, we are recording this show at the end of May, right before Memorial Day weekend. So by the time you hear this, you've probably enjoyed your Memorial Day weekend. Hope you did. Just a few other pitchers I want to talk about. Wei-Yin Chin, who was a pitcher that we talked about in our last episode, he had some elbow issues, really chronic elbow issues. He's still on the disabled list, and now he's been getting PRP treatments, which we've talked about a few times this year and last year. And generally, PRPs don't seem to work out too well for most pitchers, right?
Yeah, well, I think they haven't been doing it long enough to really have any longitudinal evidence, but when it works great. When it doesn't work, it doesn't work. I think it depends on the injury, and there's usual certain characteristics that make it feel like the pitcher's a candidate. But yeah, I would say generally speaking, they usually end up getting surgery, I think.
Yeah, it kind of looks like that's the road he's going down. Some other interesting developments over the last week or so. Phil Hughes has shoulder stiffness and shoulder discomfort. He can't seem to shake that. He's had it for a while. We're not sure what's going to happen with that. Another guy with stiffness but in his forearm is Nate Carnes of the Royals. Usually that leads to some kind of an elbow problem, as we've talked about. And more interesting for me, and maybe for you too, Jeurys Familia just had surgery for an arterial clot in his shoulder. The Mets closer was having some issues early on in the season. He started feeling some tingling in his right ring finger. They let him rest for a couple of days, and he was throwing. He wasn't feeling good again. It was going back and forth. And finally, he was diagnosed with an arterial clot in his shoulder, which is kind of an unusual injury, but maybe it's just because I follow the Mets. It's not unusual for the Mets. They've had a few of these pitchers had this kind of an issue. About 4 or 5 years ago, Dylan G had a similar, if not the exact same diagnosis. He had an arterial clot in his shoulder. Fast forward to late last year, while he was a member of another team, he wound up having similar issues and had thoracic outlet syndrome, and he had surgery for that. It's a really unusual injury, and I was curious to know is it the type of thing that just happens randomly? Is it like a genetic thing? Like when you have a clot in your shoulder, is that or is it something that could actually occur because of the pitching motion?
Well, yes, it can. It can occur because of the pitching motion, and the fact that we're talking about pitchers who have clots, and the clots are in the shoulder, and also the thoracic outlet syndrome, which is kind of like it is a blood flow situation, and it's also coming down in the shoulder area. But yes, clots, the nature of your blood vessels can have such a structure that you have a tendency towards that. It's why there's certain characteristics, and they warn you could have a stroke, etc., because a clot is what would lead to a stroke. But I think in this situation, when you have it in the shoulder, and in the medical world is saying this, that when you have stress in a part of the body, and you have what might be overuse of that part of the body, you're not just stressing the structures, meaning the muscle, which we always talk about, and the ligaments below it, which we always talk about, and the bones. You're also stressing the blood vessels, because as the other pieces don't hold their position, they're moving around. And remember, your body is a very delicately organized real estate area. So if you've got things moving around, and they have correlated certain abnormalities in a pitcher's shoulder, certain laxities that they have correlated that with a certain reading on when they do measure arterial flow, etc. And so, without getting into too medical of a way, just when the bones are moving around and there's laxity, there is stress to blood flow as well. And so I don't think this is a coincidence. I mean, I don't think we would say this is a coincidence or it's congenital. I think what it is, it's another level of the body speaking, or another warning that we have to start to take care of our pitcher's shoulders in the way that they do what they do. I don't know what else is going to have to happen. I mean, we're getting this onset of all these injuries. See, to me, when I am hearing about this, and then I heard, and you informed me that this happens a lot with the Mets, what this is telling me is that things are getting more serious. We have regular injuries, and now all of a sudden a deeper level of injuries occurring. And why is that? And it is the way that the pitchers are doing what they do that is the main tool that we have to avoid not just the usual types of injuries, but now even the ones that are more serious. And Joe, I can't help but think, I've been doing this a long time, and I can't help but think that there is an absolute reason why this is happening. And I believe, as we were talking about last week, that pitchers during the off season and sometimes as part of their regular regime are doing things with, I don't want to mention certain things, but things that are having them fatigue their shoulders even more than what is already happening and has happened over the years. Pitchers being obsessed with increasing velocity, thinking that by using certain things they can do this, or by having certain throwing programs, and not understanding that some of these issues, like I said last week, some of these ideas, some of these throwing programs, some of these mechanisms, they may in fact be okay. But when you are using them, you have to recover from them. And we know baseball players are barely recovering from their outings, let alone having things they're doing in between starts that are fatiguing their arm. And what I think is happening is we're seeing an onslaught of injuries that's coming at a deeper level because we've got more crazy things going on with the pitcher's shoulder. And by the way, anytime you have compression up at the top of the shoulder and you get into anything with the neck or the shoulder, you have to look very carefully at the mechanics as to what's going on. And when you are using, let's say you're using weighted balls, or let's say you're always throwing medicine balls, the tendency to use the shoulder slightly differently, the direction that it's used differently in, is one that can cause weird compression and weird structures to be used around the shoulder. It's not the normal way that your shoulder would work when you're throwing a baseball. That's why we look carefully at, do we want our pitchers throwing bigger balls, heavier balls, lighter balls, throwing it further? That's why those of us who are in the camp of trying to stick to skill specificity, we get worried. We get worried over the risk that we're putting our pitchers at. And what I think we're seeing here is we're seeing a tendency of shoulders to, they're starting to break down at a deeper level than just the outer levels of muscle fatigue. I think that it's showing us that things are more serious. And that's, I can't help but think that that's what's going on, because why is there all of a sudden this trend?
Yeah, and it's interesting that you say that, because I was thinking the same thing. Above and beyond the UCL injuries and then the rotator cuff things, we are starting to see that thoracic outlet syndrome pop up like seemingly out of nowhere. And I've been wondering, like, where did that come from? But yeah, I think you're onto something there. And toward the same end, and ironically having to do with the Mets, they're trying to manage all these injuries that they've been having, because they are a franchise that has been maybe a little more decimated by injuries than some other clubs. And there was an article in ESPN that we talked about earlier this week, and I think you checked it out too, where they're talking about how they're going to try to manage injuries and maybe prevent them. They're talking about maybe bringing in a director of performance science, and trying to take ideas from the NBA and the NFL and things like that. And I know you took a look at it, and I'm just curious what you thought of that article, and how you feel that major league teams might do a better job of managing injuries and preventing injuries with something like this.
Well, at first take, it always sounds great. Okay, finally they're going to bring someone in that maybe can help manage everything. They mentioned calling it director of performance science. Well, that sounds like really good. Like, oh, good, they're going to start looking at performance. But I'm always concerned, because historically, major leagues has not seen the forest for the trees. Just like, you know, when a doctor says get an X-ray, when he says get an MRI, when he says you have a blood test, the fourth thing on that list should be, and have your mechanics looked at immediately, or let's see, get someone to look at the video from the last time, so I can know what you did, why you did it, how it happened, so we now can better decide on the protocol to fix you, and what you can and can't do during your recovery, and what's going to need to happen before you try to pitch again. Nobody is putting in that little detail here. There should be somebody standing right next to the pitching coach or the pitching coordinator, looking at the pitcher, taking some film, and looking at it from a qualitative perspective. And this is not biomechanics. Biomechanics is great, but that person who's doing the qualitative stuff, the biomechanics is combined with that. But it's doing more than what the biomechanics does. It's connecting. Let's say the biomechanical analysis says, oh, the elbow angle's off. The qualitative piece is the elbow angle's off, and this is why it's off. And it has nothing to do with the elbow angle. So that you fix the other thing and the elbow angle changes. So we know we have to change the elbow angle, but you have to know what movement created that problem. And then this has to be done in a language and in a seamless way. This is the person that needs to be, I mean, they're talking about it like they need a person who's managing, like, okay, this guy's going to this doctor, and then he's going to go to the therapist, and now we got to have him on this strength program. No, this is all stuff that's happening after the fact. Let's talk about looking at the pictures from a perspective of who's at risk for certain thing, and what adjustment can be made, or what conversation can you have with the pitcher. Sometimes it's not even, let me change you, you're the pitcher, oh, you need to change. It's more like, hey dude, are you by any chance getting extra sore in the rear of your shoulder? If a person is asking, if a person knows what they're doing, that question they're asking, they already know the answer they're going to get. And pitchers don't usually lie, especially if it's, not directly, you're not the head coach or whatever. And they'll say, yeah, I am. I get really sore back there. Let me show you why. You have the opportunity not just to make that, to educate the pitcher, but to probably make the slight adjustment, give a recovery exercise. But what you've now done is you've said to the pitcher, now listen, this is what can happen. If this gets worse, then we need to look at this. Then you're creating an environment for change and elimination of the problem. We've got to start detecting these things because they're right in front of us. This is not something you have to do a blood test for. This is not a mystery. I looked at a picture of one of the pitchers you mentioned that's having an issue. His arm is so elevated, he's shrugging so high in his shoulder at delivery that of course he's going to be having some issues in that shoulder because the body does not do that when you accelerate. It's not supposed to do that when you accelerate. And when you do that, you're stressing the joint and the muscles. So I love that they're saying we need to add someone, but can we stop going around, beating around the bush here? Start looking at the way these guys are doing things. And I'm not just taking mathematical measurements. I'm talking about actually, Joe, it's what we do out here in the Bay Area, right here. These are where the pitchers come and we're looking at film, fixing things before it happens, identifying how things happened, and it works out great. These guys are being saved. So I think that for the guys that are making their living doing this is what needs to happen. And all we need is one team to say, hey, come in, take a look at this guy. How would this go down? I mean, you don't even have to have the pitcher in the room. Show me some film. That's what we need to have happen. That's more important than all this director of performance services. No, let's call it what it is. Let's get someone out here qualitatively looking at the guys, bonding with them, talking to them, seeing what their needs are, and fixing things in a way where you'll never know anything was adjusted, but that they're doing it better. And every solid adjustment improves the pitcher. So that's what I'm worried about, the tendency to try to do this big deal thing, just like, oh, let's do a big deal thing with pitch count. Let's do a big deal thing. Well, let's sit him on the bench for the World Series. Like going to extreme measures that should never happen. This should not happen but what I love is the spirit. The Mets have the great spirit of we want to do something. And I'll be darned, Joe, if I don't love that. But everything they do, I always shake my head and go, why did they do that? Why didn't they do something that would make more sense? So that's my opinion of it. So bravo for knowing something needs to get done. But could we just keep it simple? This is not a big deal suggestion here. This is like what has to happen. And it's already happening successfully in my world right here. So let's expand that. And any coach listening to this, think about this. And you know what? If you don't believe it, get somebody who, can do this and see how it goes. Because what my job is to enhance the coach's coaching. I am the assistant to the coach. I give the coach back the pitcher being better. That's what this person needs to do. Needs to eliminate the problems and the need for having a director of performance sciences. Let's get someone who's looking at these guys on the level at which they're getting injured. And this thing with all this stuff that's happening with the Mets, that's a great place to start. They're scared right now, but that's because they haven't hit the right thing yet. But this is what I believe they need to do.
Yeah, I agree with you. I feel like the Mets and a lot of other teams too, their intention is in the right place, their heart's in the right place, but I think maybe like you said, they're trying to be a little bit too big. I remember a couple of years ago they hired a strength and conditioning coach who is really well known. I'm not going to mention his name. He's really well known, but he's really well known more for football players. And it was the right, they had the heart in the right place. Like, okay, we want to bring in, the best of the best. And maybe this is an out of the box idea and this and that. But in all of the things that all of these major league teams are doing, they're talking about making sure they get the very best medical treatment. They're getting the very best fitness from the very best strength and conditioning coaches who do a great job. They're looking into the science of sleep and making sure that their players are rested enough. They're looking into the nutrition. They're bringing in nutritionists. They're bringing in psychologists, and like they're hitting all of this stuff, and yet there's still that big gaping hole where no one is looking at how the pitcher is doing what he's doing. Like it's that one big hole, and I don't know what it is. It's how you do something, and whether or not you do it efficiently is so important to not just being healthy, but also toward performance. And that's the one thing where the major league teams are completely, totally missing. And I don't understand why. I don't know if it's because they feel like they already know what pitching mechanics are supposed to look like, but I don't think that they do believe that, because every pitcher seems to have different mechanics. It's something that's really frustrating for me, and it's one of the reasons why we do this show every 2 weeks, is because there's that big hole missing
Yeah.
where how you do it. And I don't know what the answer is, but at least they're continuing to look at what they're doing and continuing to evaluate. Like it's like they're poking in a dark room, and maybe eventually they'll get the tail, they'll hit the tail on the donkey and say, oh wow, maybe we should bring in a kinesiologist or a sports scientist or somebody who knows how the body moves to analyze how the players are moving and correct them if need be.
Well, Joe, what I think is, and I want all the coaches to hear this. I think that when there's something so obvious that you're missing or not doing, and you know that if I can think it, they're thinking it too. But whenever somebody's not doing something and it's on sort of a global level, it's because they're probably afraid for one reason or another. And here's the deal: these guys are, doing it professionally for a reason. They're good at what they do. And historically, because there haven't been a lot of people who know how to understand movement and make changes, they've looked within baseball to have baseball people try to make changes. And sometimes it's worked and sometimes it hasn't. And now, even these coaches are afraid to make a change with their pitchers because they kind of are becoming aware that there's more to this than meets the eye. So, because they've had a history of not having success with making changes, and also they don't want someone coming in and changing the guy that's their big gun, they don't have knowledge and they think it's something different than what it actually is. And but what's interesting to me, so yes, I can see a coach saying we don't want someone coming in and adjusting our aces mechanics and having him look completely different, and then running the risk that all of a sudden he's going to lose his movement on his fastball, or his curveball is not going to break because they changed his arm or this or that. I think that's funny to me because the change isn't a correct change if you take away the thing that makes the pitcher good. You're supposed to be good enough to know how to make the change without changing the outcome of this guy's talent. But what's interesting to me is you should be more worried about the change in the mechanics that takes place when a kid picks up a light ball, spins around 6 times, and throws it as hard as he can, or he goes out 400 feet and throws a ball where his mechanics have to completely change to get it that far. That to me is where the thinking should be like, wait a minute, why should we be so afraid of someone coming in who's working within the framework of the pitching motion and working with the pitcher? You see, this is work with the pitcher and the motion, not as pitching. The pitching is the product. So you've got to work from the pitcher who produces the pitching and make sure that that pitching stays in place, but that he gets to that place in a better way for his body. And trust me, if a pitcher's lifting his arm up, his shoulder up, let's say he's shrugging through his acceleration, and you teach him, hey, look on the film, you're shrugging. Oh, and this is how you put it down. Oh, okay. He throws the ball. It's like the ball it comes out better. And the pitcher goes, wow, that's so much easier on my neck. And that's how it goes. So I think there's this fear of knowledge. But listen, think about what you are exposing and letting the guys do. This is like the healthy alternative. This is like a healthy alternative. And so I think that, again, like I mentioned last week, coaches try to look in the camp of, am I a guy who doesn't care how the pitcher gets it done, or am I a guy who cares how he gets it done? It's not what you do, it's how you do it. And I think we're starting to see that with this, presence of all these serious injuries that are going on a deeper level. When you're obstructing blood flow, you've had to really change the architecture inside that arm to have that system be affected, and that's what's going on. So, this has got to be a have no fear kind of approach. And again, try it. Try it. Bring someone in and see if it can make a difference. And I'm going to not ever stop suggesting that this be the direction that they go. And for the pitchers listening, pitchers, maybe the coach is never going to change his mind. Maybe the coach believes what he believes, but guys, start taking care of yourself. Act as independent contractors. You should never, as an athlete, nobody out there listening to this podcast, I don't care what job you have, we have to, as adults, take care of ourselves. So if your boss doesn't think you need more help with something, but you think you do, go out and get the help you need, because in the end, you're the one that is responsible for what happens to you. So I think there's a number of ways that this can improve, and it's not just the coaches or the major leagues, it's the pitchers starting to think a little more realistically as well.
Yeah, that's a good point. I mean, at the end of the day, it's the pitcher who's going to be on the mound or not on the mound or on the surgeon's table. So, he should be taking responsibility for his own body, his own actions, and how he's throwing the baseball. We're going to jump off the soapbox now and get back to injuries. Dallas Keuchel won the Cy Young Award 2 years ago. We talked about him last year when he had some issues with his velocity. This year, he's pitching really well again. I mean, he's back into Cy Young form, but over the last week or so, he's been experiencing a pinched nerve in his neck. So they shut him down. I'm not sure when he's coming back. He might be back within the next week or so. But I just wanted to ask you, is a pinched nerve, I mean, it's such a random thing. Like you could get it sleeping, you could get it sitting in the car or in the plane the wrong way. Is a pinched nerve in the neck, is that a big deal for a pitcher?
It's actually a huge deal because when you have the neck, which are your cervical vertebrae, the nerves that feed the shoulder and the elbow and the fingers, the wrist, the ulnar nerve, all these nerves come out of the neck, and many of them come out in what's called the brachial plexus. And anytime you have problems in your neck and you're having problems with the nerve is being compressed. And by the way, it's being compressed by a muscle. The nerves come, and it's real estate. The bones line up, the nerves come out of the side, and then they lay perfectly down, and then the muscles are over them. I mean, everything is perfect. When you have a neck bone, let's say you've dislocated your neck, or you have pressure on a nerve to where your fingers are falling asleep, or where you're getting that numbness above your elbow in the ulnar nerve area, when you have any symptoms involving the nerve, your muscles had to do something. They did something to pull too hard in the wrong way, and they obstructed the whole real estate of that part of your body. And then a bone moves, and the bone can put compression on the nerve, the muscle can put compression on the nerve. So for a pitcher, even though we're using the word neck, the neck is a big deal in pitching, because all the nerves that feed the gun come from the neck. So yes, this is something, again, you want to look at to see if in fact there's something that he's doing on a muscular level. And yes, can it be that he slept funny? Absolutely. We all know when we wake up in the morning, and boy, it's the most miserable day of your life when your neck is kinked all day. And because the muscles on the neck, they run sideways down into the shoulder, they run down the back, they run in all different angular directions. That's why we can turn our head. Those muscles have different roles, so you can hurt your neck and you'll turn to the right and it'll hurt, you'll turn to the left, it'll hurt, you tilt a certain way, it hurts. There probably is only one place you'll be looking for it to find, where can I put my head where it doesn't hurt. So it is a very complicated thing, and I'm really glad you brought it up, because I love to use the neck as a teaching moment, because I have again gathered some incredible awareness by connecting some dots about head position. And so, Joe, if it's okay with you, I'd love to go into the teaching moment and continue this discussion of the neck, and give the coaches something to go out today. If you're still pitching right now, if you're still in season, to go out and take a look at your pictures. Again, you can stand behind the plate or behind the rubber, and I'm going to teach you a few things, and because I made a fantastic connection. And this is the thing when we were talking previously about getting someone on the teams that can help. One of my concerns with the Mets was like they were going to bring in like oh, this sounds so good, this title, and let's make sure it's a medical person, a physical therapist, an athletic trainer. No, it needs to be somebody who does the kind of work that I do, where you're on the field every day looking at pitchers. So I've been specializing in pitching for 22 years, looking at mechanics every day. That's all I do. And teach the pitcher, communicate with the pitcher. And I've been 37 years as a strength coach, analyzing joint movements, etc. So this week, I make a connection that I never made before. So this is the importance of embedding yourself in the work, and that's the person who has the expertise to take care of the pitchers and make sure that they don't ruin what they've got that's good. But this thing about the neck that I just said is all true. The structures in the neck are very critical. But the main thing is the neck position that can create problems for the shoulder and the elbow. So I was noticing, so here's how I come to learn things. I all of a sudden realize that every pitcher I've worked with in the last X number of months who has this kind of symptom has this same flaw that I'm working with. And that's how I make connections. And the connection I made this week was about the head position of the pitcher when he's accelerating the ball. So, as all pitchers know, and all coaches know, when a pitcher throws in what's called overarm deliveries, not a sidearm, he's delivering at anywhere from 12 to 2 o'clock, 2:30 if a clock's in front of him, if he's a righty. The head position of a pitcher is either straight on towards the target, or as the trunk tilts to the left. I'm going to talk about a right-handed pitcher. As the trunk tilts to the left, the head moves over to the left. But what you don't want to see in a right-handed pitcher is the right ear tilting downward towards the shoulder. That is actually the way a sidearm pitcher moves his head, and it's also the way his body usually goes. So if a sidearm pitcher is reaching out to the side, let's say he's at 3 o'clock, and he's leaning in that direction, his head tilts to that direction, that is actually the characteristics of a sidearm. But if you have a guy that's an overarm thrower, and his arm is up at 1 o'clock, let's say, and he is releasing the ball, and you see his head start to tilt towards his pitching arm, that is one of the characteristics that I have seen in pitchers that have shoulder and elbow problems. Not all of them, of course, but I noticed it so much and so frequently that I started to realize that this is something the pitchers have started to do, probably to alter something that when they started hurting, they found that if they did a certain thing with their shoulder, it made it hurt less. The reason the problem for tilting the head sideways towards the pitching arm can be so problematic is because what it's actually doing is tightening up the ability of the whole shoulder joint to move easily through acceleration. So what you end up having is a tight shoulder because your head's tilted that way. So that in acceleration, you're either going to lift up because your shoulder can't move real well, or you're going to actually aggravate the shoulder structure trying to throw like that. So the way that I know that this is a connection that makes sense is that in correcting it, you cannot believe the look on the pitcher's face when he tilts his head the other way or brings it over, and you can't believe that the way it looks on film, and then they say, wow, that really freed up my entire arm. So believe it or not, we all know the shoulder joint needs to move freely to accelerate the ball. It's where you get your velocity from. And that freedom of movement is what we want as the ball's accelerated. If you tilt your head downwards, your ear comes to the shoulder of that pitching arm. The neck muscles and the trapezius muscles, which go and insert from the neck into the top of the shoulder, are then being contracted. So when you try to move the shoulder joint, you don't get the same freedom. It changes everything. And then you have a pitcher that's either going to alter the way he accelerates to get the freedom he needs, or he's going to still try to throw hard and injure the tissues. So, coaches, you all know how we want to see a head go over towards the front leg. Get behind and see if you've got any guys, especially the ones that really do it are post surgery elbow guys. So, anybody with elbow injuries that have had a history, elbow pain, I mean, these are the pitchers that I want you to watch for carefully for mechanical things that they've done that they may have done when they were in pain before surgery, and then they just kept on doing it. And so I want you to take a look at your pictures that have any problem and see if you see the head tilting. And listen, this is a simple thing to see. You don't have to have a camera. And they usually start tilting towards their pitching arm just as they start to rotate to square up. So after the front foot's landed and they start to rotate, you'll see their head tilt towards their pitching arm. And you maybe right now can picture some of your guys. And when you see a pitcher doing it, you may not know what you're looking at, but my guess is it may solve the problem of when you look at a certain guy and you go, what is it that I don't like about the way that looks? It looks very odd, but you don't always catch it because you're not really thinking about it, because nobody talks about the neck position. But the neck is flexed, laterally flexed towards the pitching arm. That's the technical term. The ear is down towards the shoulder. And if you don't believe me, try to throw a ball with your head tilted towards your throwing arm, and you'll see just how funny it feels. And it alters the glove arm, it alters rotation, it alters everything. So I want every coach to go out there and take a look at their pitchers and make sure that they don't have a neck position that is, incorrect.
Wow, thanks, Angel. No, when you're talking about the tilt, is it going to be fairly obvious? Is it going to be like a few inches, or could it be just a slight tilt? Could be a problem.
It's going to be the heads towards the arm. In fact, what it does is, you know how when you let's all picture a pitcher. You're standing behind the catcher. You know how when you see a pitcher go over his, let's say, his left leg because he's a righty. You know how you see the head. They'll say the head should be over their leg or just to the left of it.
Sure.
And you're picturing that, right?
Yes.
Well, what you will see on the guy whose head is towards the right, and it can be a little, is that you will not see his head over his left leg. You'll see his whole body either being completely upright, and this is not a sidearm. A sidearm is going to tilt that way, but so is his back. He's gonna bend his waist towards his arm and his head. This is the guy who isn't sidearm, but he's tilting his head, and so you will see that something looks off and he's moving his head towards the pitching arm. And so it can be slight, but it is, well, let's put it this way. It can't go too far because we don't have that much range of motion. And I'm
Right.
looking in a mirror right now, and I would say it's about a 1 to 2 inch thing. And what I want everyone to do, just to cement this, is when you're done with the podcast, look in the mirror, keep your eyes straight ahead, just stand there. You don't have to do anything with your arms, just look, and then tilt your right ear down towards your right shoulder, and that's what you'll see. And it is very easy to see. And then put up your pitching arm like you're going to pitch, and you're going to automatically feel, wow, that's tight on the top. So what happens is the trapezius is getting tight, and that's what causes that lifting through acceleration, which I forget which show we did. It was this season. That's one of the worst errors you see in a pitcher coming off of surgery. They lift through acceleration. And as I just got done saying, one of the pitchers whose photo I looked at who had one of these unusual diagnoses, He was lifting through acceleration, and I, of course, from the angle couldn't see as his head tilt off. But you don't want the trap getting tight. So, guys, coaches, this is so simple to catch, and your pitcher will love you. And and I know once you look for this, you'll know because, as I always tell you, coaches, you know where the head's supposed to be. You know where the body's supposed to be. You can tell when something's off, but you might miss it if you're not looking for it.
Now, if a pitching coach does see this in one of his pitchers, what's a good thing to say to the pitcher to start the correction? I know there's a lot of different things you can say depending on the pitcher or whatever, but what's a good thing to say to create that positive movement?
The easiest thing to say is first to tell him, show him on the film, or just show him, have him just stand there and put his head down, and that's going to feel familiar to him. And say, "I want your head the other way." And what'll happen is, say, bring your left ear down towards your left shoulder. And what will happen is it will prevent or give him an instruction not to let his neck flex. He's not going to have his head tilted in a weird way. It'll actually just correct it. But it's very hard to give people ways to teach things because teaching, and all you coaches who speak to me, I believe this. You all have your special way that you teach. If you understand the concept, it's why I teach concepts. If you understand the concept of what has to happen, dig inside your own talent to come up with how would I get somebody to change this? Because the teaching has to come from such a deep place of understanding inside of you that you're not only going to be able to maybe give them an instruction, but then you're going to do the most important thing. Did that instruction work? And guess what? If it didn't, say it a different way. That's why I believe in teaching you concepts. So once you understand, you could stand there and go, okay. And then you might come up with 10 different ways to say it. If the pitcher's not getting it, go to another way. Don't stick with the way that he's not getting it. And make sure that the pitcher understands. But pitchers are pretty good. Now, I did have one pitcher who it was impossible to change this, and he continued to have elbow and shoulder problems. But sometimes we run into pitchers who have a stubbornness about them. So, with that being said, you coaches already know who they are. But when you deal with a pitcher who's open to the adjustment, he's going to love it because it's going to feel better. And you know what? Even if you have him stand just 15 feet from the catcher and they're both standing up, and have him just face the target and have him put his arm back into max external rotation and then have him put his left hand on his head and pull it to the left, and then tell him not to move his head, and then just throw the ball. So he's just going through acceleration with his head tilted the other way, meaning it's not contracted, meaning he's got space between his right ear and his arm. He's going to love it. He's going to say, oh boy, and then he's going to know he's doing it, and then let him start to work with that. I have a million ways I do it, but it really
Right.
be hard voice wise. Of course, any coach that sees this, you can always contact me because I can walk you through and ideas about how to do it. But yeah, this is a very cool connection I made, and I am very excited about it.
I'm pretty excited too. And just so that we're 100% clear, you don't necessarily want the pitcher to always be tilting his head in the opposite direction, do we? We generally want him to be more straight.
No, well, the head follows the trunk, but there is a slight tilt to the left, but not. It's actually the head is on top of the trunk. The trunk is bending at the waist about 15 degrees. A right-handed pitcher is bending at the waist. If he's also tilting his head, he's going to pull over too far. But the head will look like it's tilted because the trunk is tilted. You have to understand where the tilt comes from. This is an actual neck tilt. This is the head tilting sideways. This is the head bringing the ear down to the right shoulder. The way that you just, if you look at something crooked, you'll just turn your head. The pitcher does not do that with his neck, even in the other direction. That's his waistline that does that, and the head goes with it. Do you get that?
Yeah,
In normal mechanics, there's a trunk tilt, not a head tilt.
got it. Okay. Thank
Okay.
you for clarifying.
Okay.
because it's, we only have audio here, and sometimes things can get a little confusing if you don't actually see what you're trying to
Yeah,
describe. Thank you, Angel.
exactly.
That takes us out of the teaching moment and brings us into our getting it done with science section of the show. And we've been getting a lot of emails and phone calls from coaches because the high school and college seasons are coming to an end. As I mentioned, we're at the end of May, and soon we'll have summer ball starting up. But in between, for a lot of pitchers and a lot of teams, there's a little bit of open space in between. So we've been getting some emails asking, what should the pitchers be doing? Should you shut them down, give them a rest? Is there something else they should be doing? Should they be hitting the weights? What is it that you recommend that pitchers do once their school season ends and they're getting ready for the summer season, but it hasn't yet started up? What do you do in that in between time?
Well, I get the calls that I've been getting are from, first of all, pitchers, coaches, and fathers asking that question, and the thing is, there's not one generic answer for this. And the reason is that everything a pitcher does, see, in the season, he's got to play baseball, right?
Right.
But in the summer season and in the fall, they sometimes have choices, and the choices are such that they don't necessarily have to go along with things that coaches can provide or teams that have called them. So the decisions have to always be made based on the needs of the pitcher, based on his health profile, based on how many innings he's had. For example, I had somebody call me yesterday. The father's all excited because following most of the things that he's learned from me over the last 6 years, we're going to give my son an off season this summer. Well, because of circumstances, the pitcher in high school only pitched 12 innings. So I said, no, 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 because he already is rusty. And these are people that spend a lot of money in the off season to get their pitcher great. But because of things on the team, this kid never got his feet wet. So now that he's been in season, he needs to continue his summer season so that he can hone his skill. Because if he waits until the fall or November, like some of the other pitchers will do when they pick up a ball after being off in the fall, he's going to have literally 9 or 10 months where he hasn't pitched. Because when you think of a high school season in 12 innings, that's not very many. That's 1 inning, 2 innings a month or something. So for this pitcher, and they were shocked when I said this, and they were calling for a training program, and I said, no, you got to find a travel team. So for the pitcher who didn't pitch at all, he's got to get innings. Pitchers need to pitch. Hopefully you do it in a cycle where it makes sense for you, and then you also plan your off season, because pitchers also need an off season, not to just rest their arm, but to rebuild their arm. They not an off season to sit around on the couch, an off season from pitching, but you're never in off season from being a pitcher. So a pitcher has year-round responsibilities. So if your responsibilities as a pitcher, which is to get innings, didn't occur, you don't take time off and then start to fill that. No, because see, you've at least been on a team and you're warmed up. You just haven't had enough, and now you continue. So that would be one scenario. The other scenario is a pitcher who's had a great season, and maybe he's coming off an injury and he's shocked that he had a great season. He's excited. Last year he had surgery. He returned to play. He saw consistent innings, consistent performance, and then he's asking himself, what should he do? Well, it's a good question to ask yourself, because if you had a surgery and if you did a throwing program and then integrated and returned to play just in time for the season, and you had a great season, that's the time that you take time off and layer another set of months for healing, another layer of healing on top of the surgery. Listen, guys, just because a doctor puts you on the DL for X number of months and then you're off for maybe this much time, trust me, you are still pitching with healing that is not fully taken place. When you have something in your body, it takes years to really layer the healing. So if you had a great season and you got in your innings and you met and you talked to your coach and your coach says, you know what, you did a great job, don't look a gift horse in the mouth. Take the summer and rebuild the arm and then return to play in the fall or the winter, whatever's going to happen. But if you segment your performance and then stack it with some strength, you're going to ensure that that surgery is going to hold. Remember, people have second and third surgeries. And if you're somebody who had trouble during the season, you returned to play but you never were quite right, it's perfect time to shut down and put another layer of strength on top of that and get yourself better and then pick up a ball in the fall. So be more aggressive at the end of the year than you would be right now. And then for the guys who are, of course, being sent to different places, the college guys going out to Cape Cod and they're wanting to play summer ball because they need to be seen. Out here, everyone plays summer ball unless you have an injury or something, and then you just, waited for the team year to be over. Then what you're doing right now is you pull out calendars right now because you already know you're playing summer ball. And I agree, summer ball is really important as long as everything is fitting into a cycle. So pull out a calendar that goes from May until January, February, and here's what you need to know. When does my season start in 2018? When does responsibility to my team begin? Because you might have a team that says, okay, you show up December 1st and we do 2 months of pitching and everything. Okay, so I got to be ready to show some good stuff to my coach December 1st. Okay, so then I need 10, 12 weeks to pick up a ball and start pitching because I don't want to go there and be rusty and depend on my coach to get my arm in shape. So, okay, well, that means, November 1, I'll be picking up a ball, or November 15th, and then my summer ball ends here. Okay, perfect. And then you've got a calendar that says, wow, I'm going to be actually off in September and October. Cool. And that way, if you have that plan, your summer ball is going to go great. You've got a plan. And then guess what? The coach that says, hey, I'm putting together a team and I want you to be on it in September and October. You say, no, sorry. I got to get in shape for 2 weeks or 2 months, 3 months. And then I've got responsibilities to my team. And that's how you do it. So you're either taking the summer off of throwing, or you're sitting down with the calendar and planning out your cycles. But make sure you are honoring the start days that your coach has put down for you, and you're honoring the fact that you need to have some rest at the end of summer ball. And that's the way you make your decisions. And that's a general outline and a way to think about it. And what I loved most, Joe, was getting these calls. Yeah. Is it not absolutely fantastic that people are actually thinking about this right now?
Yeah, I think it's great. I think planning is a great idea.
I mean, it used to be that nobody thought about it.
Yeah, it used to be like, all right, season's over. Now what?
Exactly. And anybody out there that's listening to this, everyone's got unique situations. They've got, I'm going to have to do a showcase at this time or whatever. This is why we hate showcases that are at times when people should be off. But, I'm going to have to do this showcase here. So then you can't take time off because you have to be ready for the showcase. So you have to juxtaposition things. And believe me, sometimes it takes hours of sitting, looking at calendars, figuring this out. But anybody out there that has an unusual situation, or any coach that's listening to this and saying, I think I get it, but I'm not sure about how to work this in, feel free to contact me. I am more than happy to help any coach with any job he has to do that involves saving pitchers' arms, which I know we all agree is what our actual journey is. So, don't hesitate to call me for clarification if you need some.
That's great, Angel. Well, I think that wraps it up for Season 4, Episode 5. I want to thank you for listening. I want to thank Angel for sharing her knowledge. To learn more about Angel, you can go to her website, gymscience.com, GYMSCIENCE.com. If you want to learn more about me, you can visit fixingpitchers.com. You can also hit me up on Twitter at fixingpitchers. Please contact us with your questions or comments, anything you have that you might want to have us address on the show. You can reach Angel at gymscience.com. You can reach me at joe@fixingpitchers. Maybe we'll have your question on the show. If you like the show, please be sure to subscribe if you haven't already. You can subscribe on iTunes, Stitcher, or however you get your podcasts. Now you can download our app, as we mentioned earlier in the show. We have the app on iPhone, iPad, all Android devices. Just go to your apps and search for Baseball Pitching the Fix. If you really enjoyed the show, I encourage you to please share it with other pitchers, coaches, and parents of pitchers, and spread the word. We're just trying to help the pitchers here. We'll be back in 2 weeks. And in the meantime, I want to wish everyone safe and effective performance on the pitching mound.